Bronchial asthma is a chronic disease. It cannot, according to conventional medicine, be healed, but only be contained. Many patients are condemned to rely on inhalers or other treatments that temporarily relieve their symptoms. Ossinin's work shows that it's possible to escape this fate. The pulmonologist has also analyzed the long-term effects. His study involved nearly 1,000 patients. After 7 years, the improvement persisted for 50% of patients, those who adopted appropriate eating habits after the period of fasting. Sometimes several treatments were necessary. 10 to 15% were completely cured. Experimental data was collected from the 4 corners of the Soviet Union, with one ambition: to establish fasting as part of public health policy. The Academy of Sciences validated the results and published them in impressive collections, which have never been translated. Despite the magnitude of this work, which has no parallel elsewhere, and the wealth of clinical descriptions and the number of diseases covered, some grey areas still remain.
Yes, the lab results show that it works, but why? How do the mechanisms that we call sanogenesis get set in motion? What is sanogenesis? I still don't have an answer to that question.
Could the answer come from researchers in the West? Over here, no state has ever funded that kind of research. The pharmaceutical industry is of course not interested. However, the practice of fasting is growing and has recently made its entry into the political and scientific arena. The next stop in our journey is Germany. In this country, 15 to 20% of the population claims to have already fasted. The oldest center for fasting was created on the shores of Lake Constance nearly 60 years ago. The motto here is the same as on the shores of Lake Baikal: eliminate. And the elimination is done in a group. The Buschinger Clinic's reputation has crossed frontiers. 2,000 people stay here every year. They come to seek relief from chronic illnesses and also for the prevention and control of risk factors such as hypertension, diabetes, and obesity. Usually, Jürgen Bahl wears a suit and tie. And no one puts a hot water bottle on his liver. Normally, he works in a glass tower in Zurich.
I'm a banker, and I had to travel in the Soviet Union and Eastern Europe. If you want to do business there, you must drink vodka and eat fatty food. The effects have accumulated over the years. My liver had grown 7 centimeters, and I had very bad blood test results. My GP, who is also a cardiologist, told me that's enough. Either you change jobs and finish with Moscow, forget Russia, no more vodka, or you take up fasting. And personally, I couldn't imagine being able to fast. It seemed impossible for me not to eat anything for 3 weeks and be hungry all day without a glass of wine. I'm a gourmet. I couldn't do it.
After the first treatment, Mr. Bahl's liver shrunk back to its proper size and his blood tests went back to normal. Since then, he keeps an eye on his diet and returns each year to Ubelingen. A spell of fasting resets his counters to 0. No, these are not the traditional glasses of water. As a small departure from the rigors of fasting, a light soup or fruit juice are served twice a day. These 250 calories a day soften the crisis of acidosis and make the first days easier. That is a particular feature of the method developed by Otto Buschinger, the man who created the center. He was an army medical officer who suffered from rheumatic fever and was sentenced to a wheelchair by doctors in 1918. He recovered with 2 successive fasts. This dramatic recovery led him to explore the therapeutic possibilities of fasting and create a treatment center. Today it's become a reference in Germany. Treatments last between 1 and 3 weeks. Pauline Valiquet has come to the Buschinger clinic for the second time this year. This interpreter, who lives in Switzerland, suffers from severe rheumatism. She has decided to fast for 12 days.
Did I think I wouldn't be able to move anymore? Yes, I did. Last year, I really had a moment of despair. I said to myself, I'm still too young to be bedridden. But that was going to be my life, especially since I live alone. I arrived in February stuffed with pain medication. I had been taking anti-rheumatics, I had been taking cortisone, all the stuff they normally give. And I was exhausted by it all. I felt completely worn out. The fasting has been the opposite of what you might think. Instead of